Great. Good evening to all of you. Denaderu, right? Please correct my Amharic if it's not good. I want to welcome you all back here for our second session with Miss Antoinette Bruce-Alexander, in which you will be talking about toilet training. And it was very interesting to hear what you have to say about it and what tools you have to give and teach us. I want to remind you all that Eye to Eye is an Israeli-based NGO with professionals, international professionals, all having to do with autism, developing the community, the community of people who work with autism or caretakers, caregivers for children with autism in Ethiopia, hoping to really bring more tools, treatments, and good interventions for children and families in Ethiopia. So I want to thank you for all of you for being here, parents and professionals, or a lot of you I know are also both. I want to remind you that this is recorded and going to be uploaded to Eye to Eye's YouTube channel in the next few days. So you're welcome to watch it or send it to people that you think may be interested in it. And as usual, we have the questionnaire at the end that I really hope that you could fill in. It really gives us great feedback to understand what was good, what was bad, what else you're interested in. So thank you for that. And of course, you're all welcome to open your cameras, whoever feels comfortable, as Antoinette also asked last week. And if you have questions during the presentation, you're welcome to write it in the chat box and I'll refer them to you, Antoinette. And at the end, hopefully we'll have time for questions as well. Yes, so you're welcome to start.
Do the sharing again here. All right. It's sharing, me?
Yes.
Okay, great. Let me just get rid of this. I see people are coming in, so I'm just letting them in as well. Okay. So for those who met me last week, I'm Antoinette. Hi. My interest lies in toilet training because, number one, I'm a mom of an autistic, well, he's now an adult, but he once was a little boy as well. So I'm also the full-time manager of an early intervention center, Autism Center, with children ranging between the ages of 2 and 10 at the moment. Hopefully we can stretch those ages until 12 next year. That's my aim now, because we have such long waiting lists to get children into special needs environments now, that when they are settled and happy in a center or a school like my own at the moment, then why not just keep them there for another 2 years if we can, so hopefully we can stretch that. I regress. I work for Autism South Africa. And the reason why we provide training is just to also help with knowledge and help people who would like to know more about autism and how to work with our autistic community. One of the things that I am working with, especially parents, I do a lot of parent counseling. And in the parent counseling, we found that a lot of the children cannot potty train like a normal child that does, and therefore we have also decided to put potty training as one of our training areas, if I can put it that way. So with further ado, we will go with toilet training. So we all think it's very easy to toilet train children, and under normal circumstances, and I use the word very loosely, normal circumstances, it is kind of easy and predictable, because the children from about the age of 2, they seem to just get it, they just know how to do things. They either watch other people, or once you've instructed them a couple of times, they get it, so it's very easy. But for some of our children, it's really not that easy. And because children develop at their own pace, and always at their own pace. We have to make allowances for some of the children who do not find it quite easy and simple and straightforward to toilet train. And I'm putting our children with autism in that category. Some of the children with autism, they never ever train, the same as they would never speak. They never train to go to the toilet by themselves. We have children who are in their mid-teens to upper teens already who still are using daily nappies. We call them nappies in South Africa, by the way. We don't call them diapers or anything else. I don't know what you call them in your country, but we call them nappies. So they are in nappies for an extended period of time. And it makes it very tricky for us as well, because in our South African schools, the schools do not accept children unless they are out of nappies already. So that if they've only been potty trained, then, and even when the children are entering a special needs type of school, although it's actually against our Children's Act and Schools Act here in South Africa under our constitution, the schools do find grey areas and loopholes not to admit these children. So it's an area where we are still, it's a fighting area here in South Africa, where we have to almost browbeat the schools into accepting the children. So it is easier now if we can provide the tools to parents to help with toilet training so that we can get the kids settled quicker into school. So it's only when the children can understand when they are wet or dry, the age is correct, that they then start toilet training properly. So the neural pathways in the brain must also be mature enough to understand and to understand the concept and the bodily function of toileting. And there are two parts to toileting. Number one is bladder control, and number two is bowel control. So there are two parts of it as well. So most problems that we encounter with toilet training is our own expectations. As a parent, you know, we have this thing in our head that a child must toilet train at a certain age. They must just get out of their nappies and then into their underwear and clothes. And it's almost that we have this mindset of time, date, place that things must happen. Timelines that are our timelines, not the children's timelines. And that is something that we also need to be cognitive of, that we put pressure on the children to perform. And in actual fact, some of the children just cannot do it. Obviously, some medical problems might arise as well. We do have some medical conditions where it interferes with toileting. So we have to look at those things as well. And we sometimes get a huge amount of good advice from our parents, aunties, schools, our wonderful doctors. They can be brilliant. The advice that we get is good advice, but does it fit the child that we are working with? And sometimes no, it doesn't. So the well-meaningness, the brilliance of the doctor, our own expectations, that all interfere with children and toilet training. So my advice always is just relax here, please, just relax, because it'll happen when it happens. But we are putting a huge amount of pressure on ourselves and the child. So just stop. Breathe, people. It'll happen. But we just need to give the children a chance to mature enough for that to actually happen. So let's look at quickly at normal toileting development. From about naught when they're born to 18 months. We call it the toilet timing reflex. So the child's bladder fills up, and it's a reflex action of the body that the bladder just voids. As it is full, it just happens. There's no thought about it. There's no control over it. And in that time period from birth to 18 months, we see that the children are very seldom seldom that we can say that we can start toilet training with them. Between the ages of 18 months and 2 years of age, sometimes we see that the children, if they are quite forward in their development, they will start toilet training. But the problem between 18 months and 2 years, and even beyond that, some days, is that there is absolutely no notice. If the child wants to go to the toilet, they want to go right now. And there's no advanced notice to us to say, my bladder is full, I want to go to the toilet now, so that we can actually get them there. So that action just, want to wee wee. We call it wee wee. I call it wee wee. And then they just let it go. So there's no notice. But after the age of 2, we see that from about 2 years to 2.5 years, we will find that most children will start with toileting. The neural pathways are developing. They can tell the difference between wet and dry. We have to understand that toileting as bladder control comes first. And then about 6 months later, we get bowel control done as well. So that is just the timeline that we are looking at. About 75% of children at the age of 2.5 would be dry already. They would be out of their nappies, they would be into their underwear and normal clothes, and we would have very few little oopsies and accidents happening. But we have to understand that something called toddler urgency is always there. If they say they want to go to the toilet, we have to understand that they want to go right now, which is why we sometimes also have parents with little kiddies on the side of the road, stop the car, let the child out, and just in the gutter or next to the road, quick, let the little girl sit or let the little boy stand. And we have these almost near accidents when you are in a shopping complex or at the shops. Then the child would want to go to the toilet immediately, and you have to know where those toilets, the public toilets, are in where you are in the shopping complexes, or even at a friend's house when you go and visit them and you are busy toilet training a child. We have to understand that those people must realize that this is not an easy thing. We need to get those kids to the loo now. So that is just the normal development of children and how they develop with their toilet training. So 18 months, not to 18 months, don't even consider it. From 18 months to 2 years, there might be happy accidents, happy accidents. From 2.5 years onwards, you are almost golden. You can now say the child can almost by themselves say, I want to go to the toilet. They can control it a little bit better. They can give you a few moments of advance notice as well. But I would say 2.5 years is the earliest that we can actually say safely that it's time to start toilet training a child. Not just a child with autism, but any child. One of the little controversies is, do we use a full-size adult toilet for a child, or do we use a potty? I don't know what you use in your countries, but we sometimes use a potty, a little plastic device. Don't know. Yes, I'm just going to go with it. So there is always that, must they use a full-size toilet or mustn't they? We can investigate some of the things that would make life a little easier, like under the toilet seat, we get a little insert for little kiddies that they can sit on, to make the opening of the toilet a little smaller. Or if the potty is available, we must make sure that the potty is stable on the floor, because sometimes if the potty moves a little bit, then the child becomes unsettled and unhappy sitting on the potty. So we just have to find out where the child is most comfortable. So fundamentals now of bladder training is that the child must be comfortably seated. Their feet must be on the floor or on a stable surface. For instance, there with the proper toilet, we have a little bench underneath the toilet where the child's feet can rest easily when they have to sit or stand. so that they are comfortable. You know, if you are an occupational therapist, I don't know if we have any occupational therapists on the group now, but they will tell you the knees must be at a 90-degree angle, the feet must be flat on the floor, and the child must be seated in a comfortable 90-degree angle before a body becomes comfortable. The child must be able to feel if they are wet or dry. Before that, there is actually no point in starting to teach a child how to use toilet, because if they have not yet made the connection between wet and dry, then there is no point in starting yet with toilet training. They must be consistently dry for a couple of weeks before we can say at night that we can take the night nappy away as well, because we are going to be cleaning bedding continuously until we can see that the child is able to control their bladder during the night as well, before we get rid of that night nappy. And I would say for any child toilet training, we would have some kind of structured plan in place. If they go to school, then the school must be aware that you have started with potty training at home. They have to follow the same as you do at home, or if you are able to, vice versa, to slot in with a program that they are running at school as well, so that you do one job. You don't do one thing at home and one thing at school, that they are actually the same thing. So get a structured plan in place before you start with your toilet training. The bladder training strategy plan would be, is the child old enough to start? Can they tell the difference between wet and dry? And if you take the nappies away and you use only pants or underpants, can the child then determine or themselves feel uncomfortable if they are wearing underwear and they are wet? If they can show you in some way by pulling at their clothing or pulling it off themselves, then we will be able to start with toilet training. You have to encourage children, and don't make it like over the top, because a child loses interest very quickly if you are fake. We can't be fake people. We have to encourage children. We have to be glad for them if they have a success, but not be a fake person. I don't know how else to put this, because sometimes you are so over the top happy for the child that you come across like a fake person. So don't be like that. When your child has had some kind of success in the toilet, then it is time to praise, definitely. We never scold if they don't do anything on the toilet, bladder or bowel control. We never ever scold a child. We never discipline them. If they have made an oopsie or an accident in their pants or underwear, then we never will scold them. It's counterproductive in the toilet training department. We don't scold. For little boys as well, the other question is, should they sit when you start with toilet training, or do we make them stand? So number one is, for little boys, if you start teaching them to stand when they have to go to urinate, bladder control, if they have to stand at the toilet, yes, we are going to clean up messes. Yes, we teach them to use their own equipment, because they have to hold it and play with it, but you know what I mean? Hold it and aim it and fire away. We call it the little fire hose. But if you make them sit at the toilet, or if they prefer to, later, because we are looking at a social environment where people grow up and they have to go to the loo and use a public toilet, it's very seldom that you find men sitting at a toilet in a public urinal or at a public toilet. So we then have to retrain them for them to fit into a social environment as well. Bowel control happens about 6 months after bladder control, and you have to choose a time for bowel control, for bowel movements training, where you are all happy, content. This is the time about 6 months after bladder control has been established. We take them to the toilet 3 times a day for bowel movements after meals. Why that happens is because when you have eaten your meal, your intestines and your bowel movements happen automatically. So after meal times is the best time to take them to a toilet for bowel control, for bowel training. Again, we have to be extremely patient with our kids. Bowel control is actually a lot more difficult for the children to get right than bladder control. There is a process of relaxation involved, a process of opening muscles, a process of almost a part of their bodies leaving the body. And then also, when they have a traumatic experience in the toilet the first time, and that could be something very simple like the bowel movement has now hit the water that is in the toilet and the water has splashed up, and the child has this cold splashed water on his bare bottoms. And then the child gets a fright and they think, I'm not going to do this ever again. So we have difficulty in bowel movements and bowel control as well. But once it happens in the toilet, you can then praise them a lot because this is something very big that has happened. Bowel movements, first time that it happens in the toilet, you can actually go overboard with your praise with that one particular event in the child's life. You can actually WhatsApp all your friends and all the family to say, first time ever. My son's name is Daniel. Daniel has sat on the toilet and made a poo in the toilet. First time ever. And then you'll see all of your friends are going to be quite happy with you for that one thing as well. Toddler urgency, we have talked about. Bedwetting. Bedwetting can sometimes happen after the age of 5 as well. We sometimes find teenage children still wetting the bed, and it's more common in boys than girls for some reason. But if you find a couple of nut nappies dry, then you can try take them off the nut nappies. We have got things that we can do. For instance, we call it lifting. You take a child out of their bed, you sleepwalk them to the toilet, or you take them to the toilet. You make them sit on the toilet and you hold them so that they can have a bladder movement in the toilet. Then you're going to sleepwalk them back to their beds again and put them back to bed again, so that they in the middle of the night can get into some kind of a routine where if they don't wear nappies, then they can go to the toilet with your help. You just take them there and take them back again. Watch their quantity of liquid intake at nighttime, and there should be some kind of cut off at night, maybe 5 or 6 o'clock at night. Depends on when the child goes to sleep. Then you have some kind of a cut off point where you don't give them glasses and glasses full of liquid to drink, that they must stop drinking anything. Then they can void their bladder before they go to bed so that they don't have accidents at night. We also have a bedwetting alarm, and this is a little battery operated. It's got a piece of wire with a metal tip in the front that you insert into the pajamas or underwear that the child is sleeping with. For the boys, for obvious reasons, you're going to position it further up in the front of the underwear, and for little girls, it'd be a little bit lower down in the underwear, so that when the child wets themselves at night, the alarm goes off and they will wake up and they will take themselves to the toilet then. It's a very useful little thing to have, but I found some of them on the internet that you can buy. Some of the shops here in South Africa may sell them, but it's not a cheap thing to buy. So I would say try some of the other things rather first. Now for autism and toileting. Autism and toileting is a nightmare for some children. It is. Where we think it's easy with normal children, neurotypical children, try a child with autism. Just a funny story. We have dogs. We've always had dogs at home. And our dogs have a big water bowl outside at the back door of the house. And Daniel was about 4.5 years old already, still wearing a nappy, just refused toilet training up to that point completely. And I saw him one day outside our back door taking his nappy loose and wee-weeing in the dog's water bowl. And I said, no, 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 wait. I said to him, this water is for the dogs to drink. You can't wee-wee in there. And I fetched a bucket and I put a little bit of water in it and I put it next to the dog's water bowl outside. So I've made this plan that the water in the bucket would then substitute the water in the water bowl and he could use that. So then we moved it from outside to the back door, into the back door, all the way in the kitchen, down the passage, into the toilet, and then next to the toilet. So it took me a couple of weeks to get this bucket with water into the toilet. So it took me a while, but in the end, we got him to do his business in the toilet, but it took a while for us to get that one right. So don't think that with autistic kids, you can just follow a normal toileting routine either. We've got to think a little bit outside the box here with autistic children as well for toileting purposes as well. So I'm just going to go through a couple of practical things that we can do. When do we start? Only after a couple of weeks of observation, and I'm going to show you how to do that. When we know that the child can distinguish between wet and dry. Now, I want to show you something. This here, I don't know if you can see it, is a modern nappy. A modern nappy has these elastic pieces that go around the leg and outside of the leg. So this goes into the groin. This goes where the elastic of a pair of pants would be. Then we've got this very soft cotton layer. Inside here is a blue gel. That gel is meant to suck up any urine and lock it in there. This inside lining here keeps the body of the child completely dry. So now the child has no way of determining if I'm wet or dry, because this thing is our enemy where it comes to toilet training. This thing needs to be thrown away. When you are serious about toilet training your child, this thing is the first thing that goes, so that the child can then become independent and wear their own way, like big boys and girls. Then observe them, and it's going to take a couple of weeks. So I hope you are all ready with buckets and soapy water, because you're going to have to clean up a few accidents. But only when they can make this connection between wet and dry will they be able to do the toilet training with us. The visual thinkers and learners, most of them. So if we think that a child learns with their eyes, and we are of the persuasion that, okay, the child has made a mess in his nappy, we must now change the nappy. Where do we change the nappy? The mom normally says to me, I take the child to the changing table or my bed on the bed, and you lay the child down, you open the dirty nappy, you clean the child up, you clean with wet wipes and tissue papers and whatever. You substitute the dirty nappy for a clean one again. Then what do you do with the old nappy? You fold it up and you close it up, and most people put it inside a plastic packet, and then it goes in the dustbin. So I say to the parent, if your child is 5 already and the only thing he has ever seen you do with a dirty nappy is to put it in a plastic packet and throw it in the rubbish bin, what did that child learn about toilet training? That my dirty nappy or my poo belongs in the nappy, in a plastic packet, in the dustbin. They've never learned that they must go to the toilet and do their business in a toilet. So we want to change, as visual thinkers, we want to change that idea that they must use a toilet for this. So we take them to the toilet, undo the nappy, shake out whatever is in there, inside the toilet, and let the child flush. And then they will start making the connection between where it comes from and where it must go to, so that we can help them associate this idea of toileting. So the first thing that we do with the observation is we use a 3-week chart. We divide a chart, a spreadsheet, a chart into 15-minute intervals. And we do it from Monday to Sunday, or whichever day of the week you start your toilet training on, but we do a 7-week consecutive week. Then we divide it into 15 minutes, and then we're going to write a small little number 1 with the exact time next to it for a wee wee, and then a number 2 for a poo and the exact time. And why we are doing that is because this is going to help us track the child's natural body clock. We all have a body clock, and I can guarantee that most of you today here will get up in the morning at a specific time and your bladder has to void. When you've had your 3rd cup of coffee, like myself, in the morning, then you want to go to the toilet again to go and void your bladder. If we can record on this chart the exact time that the child goes to the toilet and what they do there, at the end of the first week, we have a pretty good idea of what happens in the child's natural body clock, the natural body rhythm. The second week, we are going to do an observation and a recording week again. We might start encouraging the child at the time that we see on the chart. When we see that they are going to have a wee-wee at this time, we then start encouraging the child. You want to go to the toilet with mom, maybe? Come with me. Then we encourage the child, but we still record the times at the time when it happens. The third week, we're going to call a working week. That week is when we are actually going to physically start training the child. At the time that we've recorded over the last 2 weeks, at that time, we're going to take the child to the toilet and encourage them. But we are going to work that week. So it normally takes about 3 weeks with this plan for a child to be able to toilet train. The go with a parent method works very well if a boy child goes with an uncle or a father or an older brother to the toilet, and they just go and copy them. They go and watch what they do, they go and copy them, they go and mimic what they do. So for a girl child, it would be best to go with mom or an older sibling or an aunt to go and see what happens in the toilet. Because if they can see it, they can follow it. If they can see it, they can do it. It's just a go with parent. We can use a lot of visual schedules for them as well. There's quite a lot of schedules. If you go, and I've put the site there for you, it's called Do to Learn. If you go into that website, you can get a whole lot of free downloadable, printable PDF copies of schedules that you can use for the child as well. Anything that you would like, school-based, home-based, toileting, hygiene, it doesn't matter what it is, you can get from this website. It's free. You can go and look at that website. You can go and get a schedule for the child, and it's as complicated or as easy as the child requires. So we're looking at the child, at their development, at their needs, and then we go and print off lists like this in picture form, and then we can use them to see. The child can see what they are supposed to do. Part of this would be a very specific and direct instruction. If they are supposed to wipe the toilet paper that they are using for wiping, you also have to give them an indication of how many squares they must use. So when you've got a picture like this one where there is a toilet roll or toilet paper, also make sure that you give them quite a good idea of the measurement of it, or if they can use it, how much they can use. If you put a picture up, for instance, when they have to wash their hands, of washing hands, and you get to the soap part, we all after COVID, I think it is a worldwide thing, switched from cakes of soap to hand pump liquid soap. because it's just more hygienic. So if you have liquid soap, but you've got a picture of a cake of soap, our children are so literal and concrete in their thinking that if they see the cake of soap, but there's no cake of soap in front of them, then they might not be able to use it because they don't know what to associate it with. There's not generalization here. So also the same thing with a towel. If your picture towel is cream colored, but your towel that's actually hanging up there is green, they might not know that that means the same thing. We need to teach them generalization as well. So we can use an object schedule for the child, which is first and then. First, we're going to change your nappy, and then we're going to have a reward, so you can use real objects. First, we're going to use your nappy, and then you can get your biscuits. Or first, we're going to change your underwear, and then you can get your biscuits. So just visual scheduling for them as well. For little boys, we can use toilet toys, and that could be easily dissolvable cereal. Fruit Loops work very well. So if you get a couple of them and you throw them in the toilet water and you tell the child to play aim games with wee-weeing, you see if you can wee-wee onto the Fruit Loop inside the toilet, then maybe the child will see it as a fun game. For little girls, if they are using a potty, you can sprinkle a little bit of Enos or bicarb of soda in your potty underneath if the potty is dry. And the moment the child sits on the toilet and they wee-wee, or on the potty and they wee-wee, it'll start fizzing. So it's all little things that we can help the children with, just in trying to get toileting to be a little bit more fun for them as well. Other things that we can do to keep them busy is drawing. And this is actually my mother-in-law's toilet that I used to draw on the lid with a whiteboard marker. Obviously, you're not going to use permanent markers. Put the child back to front on the toilet so that they are facing backwards. And then you can give them whiteboard markers and they can scribble on the lid of the toilet as well. It's easy to wipe it off. It comes off very easily. You can give them coloring in books, give them books to read, give them some kind of feature toy that they can play with on the toilet as well, just to keep their minds busy and active. And then you'll see that the successes are better and quicker and easier because you are actually giving them a different activity to focus on, and their body can naturally void itself then. Generalization, if you have a school and a toilet at home, and those two look different. At school or in the centers or wherever you go, sometimes the toilet is in long rows of cubicles and the children can't associate because they can't generalize. If you have started a toilet training routine home, and this is the one where your toilet looks at home, but at school it looks different, and you can take a color photograph of the one from home and a color photograph from school, and you go and swap them around and stick them up. The school one you stick above the toilet at home, and the home toilet you stick above the toilet at school, so that the child has a reference point as well, and that they can understand home. I can use this one at school. It's the same as the one at home. It just looks different here. But we have to start generalizing with skills issues. So the next thing that we have to consider is the sensory problems that they face. Now, one of the 4 areas in autism that we look at when we diagnose children is the sensory issues. And they can be hypersensitive, hyposensitive in one sense, or in all 8 their senses at the same time. So if we're looking at toileting, there's the flushing of the water in the toilet. There's the flickering fluorescent lighting in the toilet. There is the fact that the toilet opening is too big and the child is not stable. So their vestibular system is not quite working. Your positioning of your body on the toilet, the proprioception is not working. The smell, sense of smell, dreadful when you go to the toilet. So we have sprays in the toilet, we have the toileting smells themselves. Sensory issues is a big problem with our children. So we have to understand that sensory is impacting toileting quite a lot. So we need to figure out, is the child sensory overstimulated by going to the toilet, and what can we do to assist? One of the things that we can do to assist is looking at toilet paper, the quality of your toilet paper. And then we have to also look at something called fecal smearing, poop smearing, and that children might engage in poop smearing or fecal smearing for a various number of reasons. They can have stimming problems, that they want to touch it because it feels, the texture is what they are looking for. They could do it because they are having dysregulated behavior. They could do it because there is a sensory problem as well. They could do it for a lot of reasons. And it's okay. It's okay. We just need to find out why they are doing it before we can make a plan with it. So there are many reasons why they do it. They could be feeling sick. They could have a runny tummy, and it's surprising to them. So they might have a problem with a runny tummy. The toilet paper is too hard. We could give them a wet wipe or softer toilet paper. The child might be scared of the toilet. They might not know where the poo must go to. Where does it belong? In the toilet, in my nappy, in my pants? What must happen to this poo? They might look for sensory input. For instance, if it is a tactile thing and they are looking for the stimulation, the feel of it, instead of playing with the poop, I don't know if you get aqueous cream, thick body cream. They call it aqueous cream. Aqueous cream or thick body cream could be a substitute for playing with that. We could take a nice big dollop of it, put it in their hands so they can play with that instead of playing with a poo. There could be a few things that we can do to help them, give them a stress ball to play with, for instance, so that they can play with that instead of poo smearing, for instance. Okay, we could do social stories or social narratives. That's one way of teaching them about toileting. And this you can also go and have a look. It's called social stories. I don't know if you know about them. If you don't, please go and look up Carol Gray from the Gray Center. Carol Gray devised something called social stories. It is a teaching tool for children. It helps with overstimulation. It helps with traumatic events. It helps with teaching new skills. And there's a specific way of writing these social stories, and it is very much individualized for the child. It's written in the first person as well. So if there's a social story and it's about me, I would use the language of I and me, not my name, and not you would say, I am teaching you. It's a first person thing. So I am afraid of going to the toilet. My mom says that if I go to the toilet, it would make her happy and I would feel more comfortable. So it's a very much a me and I story, but you have to personalize it for the person and make it situational so that it becomes the child's own tool. We can't use it like an antisocial story where you give too many directives and too many instructions. It becomes then a set of instructions instead of a social story. We must go and have a look at the difference there as well. But please go and have a look at Carol Gray's social story and how to write it. There's quite a lot of information. Every person's worst nightmare is regression in a child. So they've come with potty training this far, and now all of a sudden I see there's regression happening, or maybe just a complete standstill. I don't like the word regression. I call it sidestepping, because we are really not regressing. They have already learned and mastered a part of the skill, but now something has happened, so they are sidestepping a little bit, and then they will continue again. So there might be a lot of reasons for that. There might be the child wasn't ready and that we pushed too early for the child to get trained, or a change in their routine, their environment. Something traumatic might have happened, not just at the toilet, but something like the birth of a new baby in the family. Now all of a sudden I see mom took away my nappy, but this child is using a nappy. Now I also want one. So now the child is insisting on going back into nappies again instead of using their big girl underwear, because they saw the newborn baby using nappies. And what they see, they want to do. So we must understand that sometimes changes happen, sometimes things are happening in the child's life, sometimes they are not feeling well, and we need to give them time so that they can process what's happening inside their bodies, around them, give them space to breathe, give them space to process, and then we can start the toileting process again. Renana, I don't know how we're doing with time.
You still have about 40 minutes.
14.
40, no,
40!
yeah,
And
but
I'm racing through this thing for you tonight.
yes, but we also want time for questions, so let's
Yes,
say you have about
right.
5 minutes, something like that.
Okay, so bedwetting, I think we have handled bedwetting, but I want to say that it is quite normal for children to wet their beds. And if we're looking at older boys, we also have the happy accidents of, may I speak of other bodily functions.
I don't know how to answer that. Okay.
Okay, so how to put this very sensitively? Boys of a certain age have certain things happening in their sleep that has got no control over those things that happen. Okay, it is part of being an adolescent boy. Is that sensitive enough? Okay, great. So being sensitive to boys and boys' specific needs as well. We're not just looking at bedwetting for boys of a certain age. Okay, we're also looking at that type of thing as well. My first thing would be you have to be as factful and truthful with a boy when he asks questions. We don't hide these things. It's not a shameful thing that's happened to them. We have to answer them the questions as in as much detail as we can. And I know in certain cultures and in certain beliefs, the woman cannot talk about these things to boys. That's a man's job. Okay, so yes, then discuss it with dad. Dad discusses it with a boy because that's not the woman's place. I say I'm a mother, and my child, if my child comes to me and asks me for things, then I will answer him with as much truth and facts as I possibly can. And that's just me, okay? But other parents and other cultural groups might not feel the same way, and that is also okay. They can do it in their own way. But for bedwetting, I would promote a cover on the mattress, which is a rubberized cover for the mattress. In and on that, I would put a set of towels maybe, and then the sheet, and then the child can sleep. Because accidents do happen at night, even normal children have accidents at night as well. So bedwetting is not abnormal for our children at all, girls and boys. We just need to make sure that we don't give them liquid at a certain time or from a certain time. And then also just check that bedwetting is handled in a correct and sensitive way and manner as well. So for center, in a center, because I run a center, we have the children in our center split into different age groups and different ability groups. The first age when they come in could be anything between 18 months and 2 years. After that even, because sometimes the kids are diagnosed quite late, so we get them after diagnosis. But most often, and I mean the majority of the children that come into our centers do still wear a nappy. They have not yet been potty trained. So our job in the center is to make sure that potty training does happen. So there's a few things that we do. We take the children to the toilet individually or in small groups of 2 or 3 children. Then we take them to the toilet and we do their toileting routine with them. We have pictures, we have it scheduled every single day in their routine for the day. We have that toileting card in there. It's there permanently so that they can understand that when it comes to after snack time, we have washing hands time, but we also have the toileting routine. It's all built into their daily schedule. We will do an assessment on each child that comes into a center because we want to know from the parent, what have you started? If you haven't started it, we will assess the child at the school to make sure that they are ready. If they are not ready, we are not even attempting it yet. We will just do the nappy changes as it is required throughout the day. But when the children are ready for toilet training, we will take them through that program of toilet training, and we then ask the parent to join us in the toilet training routine so that we do it at school and they do it at home as well. It is quite a lengthy process at a school, as you can imagine, because we have 40 children in our school. So it takes a while, and specifically because the children have never been to a school before, they have, some of them, never even seen a toilet before. We have to start training them from the very beginning with all of these daily things that we do. As the children get older and they are not requiring so much support, we start taking toileting out of their routine, a proper structured routine at school. We start phasing it out. We start phasing in the self-asking for toilet. So last week when I was doing Macathon, can you still remember what the sign is for toilet? Remember, we
Yes.
did toilet this way. All right, so we start phasing out in the routine the toileting, and we start phasing out the toileting routine and phasing in a system where the children can independently ask to go to the toilet. Because as adults, we are not required to follow a schedule for toileting. We are quite free to go to the toilet and use the toilet whenever we want to. So we don't want to make them prompt dependent for toileting. We want to phase that prompt out as soon as possible so that they can become more independent. We teach them signs, we teach them PECS, the picture exchange communication. We give them some form of freedom to ask for toileting, and then they can go by themselves. Center-based, obviously, when the children are really young, we have to accompany them to the toilet. They are not free just at 3 years of age to just run by themselves. We don't have toilets inside our classrooms, which would be ideal, thank you, but we don't have them. So we all use the same bathroom for all of the children. And that way we all have a teacher and an assistant per class, so that then we can to take the children to the toilet through their toilet routine and help them there as well. So it is quite an involved thing at school, because it's not myself being one child that we are toilet training. We are toilet training quite a lot at the same time. So center-based, it becomes key business. And I've raced so through all of this presentation that now I'm done. And now I'm here for questions.
Okay, wow.
I'm going to stop sharing so that we can just have a discussion. Is that fine?
Yeah, that's great.
Okay, good stuff.
Okay. So are there any questions from people here about anything that Antoinette mentioned? You could also open your microphone or your camera, or just write it in the chat, whatever you feel comfortable with.
I see that there is a question, Leah. I don't actually have a soft copy of a chart like that, but I'm very sure that it's quite easy to draw it up. If you want me to do it, I can draw one up. I've only got a hard copy of it. It's just a piece of paper that I use for training purposes. So if you would like me to, otherwise it might be quite easy for you just to do it on a spreadsheet, depending on if you would like to or not.
Yes, we would like to use that technique.
Okay.
Thank you so
All right.
much. Yeah.
Okay.
So
I will draw up the spreadsheet for you, and I will
okay.
send it to Renana, and Renana, you can then forward it to
Yeah.
them.
Sure.
Okay,
Thank
great.
you
Yeah,
so much.
the chart works for me because it is not an invasive thing. We are using a natural body clock method of tracking the child. And then if we use their natural body clock to train them toilet training, it works much easier.
Agreed. So at our center, we usually do, give them time after their maybe lunchtime or maybe after snack time. But
Mm-hmm.
this technique is, I think it's more natural, like you said. So I want to apply that at the center as well.
Okay, great. Yes.
Yeah, and I don't have any questions because I was going to write a lot of questions regarding especially nighttime accidents because I have an 8-year-old. I think I've been struggling with the nighttime routine, but the
Yes.
techniques that you've mentioned that I can apply, with the alarm, because you said earlier you mentioned about this device, but it's not
Yes.
going to be visible or we wouldn't have the access to have it here. But setting up the alarm to wake up our
Yes.
children and
That would also help. Yes.
yeah. So
If
that
the
was
child has any kind of electronic device next to his bed with an alarm set at 11 or 12 o'clock at night, that
Mhm.
normally works best around 11 or 12, because if a child goes to sleep at 8, I'm just using an example, nee?
Yeah.
By 11 or 12, they've had 3 hours of sleep and their bladder has filled up.
Mhm.
Now, when the bladder is full, by 11, 12 o'clock, then the bladder voids by itself. If the child is not woken up by themselves, that signal that goes from the full bladder up here to say, alarm bells, please, you must get up now to go to the toilet. So we will then schedule it at nighttime with an alarm for them to get up.
Yes, that's actually a great
Yeah.
suggestion because I've seen him struggle with, waking up because he's in a deep sleep state.
Yeah.
So I think he usually wakes up to other noises. So I think adding an alarm and teaching him to wake up and do the routine,
Yeah.
because he doesn't have a problem with actually like doing the activity or doing the task.
Yeah.
So I think this is like good experience sharing. Thank you so much.
Yes. I see Hannah has written a message. How do we, what can we do for children over the age of 11 as a caregiver to make them independent? Hannah, I would suggest just using a picture for them. The child needs to be, if they are able to follow a routine or a schedule picture format, then you can put a toilet card in that picture for the whole schedule for the day. I don't know how you work with the children. I'm just looking at your question now to them use the bathroom independently. So it's easy to put it in their daily routine or daily schedule, that you put the toilet card in there at certain times if they are able to follow that routine. But once they get to the bathroom, and if it is a boy, and the boy has been taught to stand at the urinal or the toilet to make a wee-wee, then what we would do is above the toilet against the wall, we would put a sequence up there of how you must do this. And this sequence can be as easy or as complicated as you need to make it for the child. We can say, face the urinal or the toilet, pull down your pants or unzip it depending on which clothes they are wearing. Then you can say, pull down your underwear. Then you can say, urinate, but you can show them the picture of how it's done. Then you can say to them, whatever is the wiping or cleaning themselves up, pull up your underwear, pull up your pants or your trousers, and then flush the toilet, because the urinal even has a flushing mechanism, or the toilet. And then the next step would be going to the basin to wash your hands. But that can be in a picture sequence, as complicated or as easy as you want it. If the child has to make a number 2, a poo on the toilet, you would then put another sequence of pictures on the bathroom door, because now the child is in the cubicle or in the bathroom, and then they've closed the door for privacy and social, close the door. Then behind the door, facing the child, when the child is sitting on the toilet, there would be a whole sequence pasted up there for them as well, that they can follow step by step by step by step. We have worked it out that as toilet training for a number 2 to go to the toilet, there are up to 26 different steps that must be followed just to go to the toilet. 26 steps. That could be looking at a social perspective, knock on the door and ask if it's occupied or not. Open the door, close the door behind you. So there's a whole social thing to look at. There's the whole action of undressing, of sitting. All of that is worked out in steps. How many times can you wipe with toilet paper? How big must the toilet paper be? Getting up, pulling up your clothes or dressing again, flushing the toilet. There is so many steps to a number 2. It is absolutely incredible. There's always that step when you go and sit on the toilet where, and I said this before, your body needs to be able to release. Because if you tense and you go and sit on the toilet, you cannot open the muscles that holds the bladder and the bowels controlled. So there's that step where we all follow when you sit on the toilet, even if you're in a rush, where you have to go before you can do anything. Even that can be put into the sequence as well. Take a breath. And as many steps as possible that you can put into that sequence. I don't know if that answers, Hannah. What signs should we look out for indicating a child is not responding because the strategy itself versus not being developmentally ready? Okay, so if you find that you have now taken away the nappy and you've given them underwear and consistently they are wetting themselves, but there is absolutely no indication from their side that they are getting uncomfortable. So if I can stand up, I don't know if you can see. So especially for little boys, they would start pulling at their clothes, but pulling it forward and away from their body because they are wet. So you would look for that sort of pulling on my clothes action before you can see if a child is ready. Or they would simply strip out of their clothing if they are uncomfortable and wet. And if they can feel it, if they can make that association. If they can't, they will walk around with wet clothing and they won't even feel it. They won't register. So we have to give them time, and this is where the observation comes in, that you can start seeing a child who goes behind furniture or into a different room when they are still wearing clothing to go and make a poo away from you. That child might be indicating to you that I know what I'm doing now. And you can start with toilet training with that child already. I hope that answers that one. And then at what point is it best to pause toilet training and try again later, especially for children who may find the process overwhelming at any time? If you see that the child is not responding or is becoming anxious because of the process, then give up. Step back, take a month off, breathe, relax, and then in a month's time from now, try again. Just give them time to acclimatize to the idea that we are going to be toilet training. But the moment you put pressure on a child, then they become anxious and then they won't be able to toilet train. So we give them time. We, at any time during this process, when you see that the child's anxiety levels are rising just because we are toilet training, then step back. Give them chance, give them time off. Even if you see that with the birth of a new baby and the new baby is in nappies, and for them, it's not regression, it's I'm copying and mimicking now, then you give them that opportunity to do it. Give them a week or so and then take the nappy away again. They've had their chance. Now you go back to your routines again. I hope that answers. Okay. What if the child follow routine, they are out of home and refuse in home? Okay, so that's where I come with the pictures. You take a picture of the toilet at home, and when you are out of home and you are somewhere else, you can show them the picture of the toilet at home, and you can still try and get them to cooperate when they are out. For instance, in a shop or at church or wherever. So if they have learned toileting in one environment, we have to try and generalize the same somewhere else as well. It takes a while. Nothing that I've said tonight is a quick fix. Ne? There is no magic wands here. Nothing. We have to, this is trial and error. We work with the child, we work with the ability of the child. If we are overwhelming the child, maybe our expectations is too high and we need to come down to their level again. We need to give them the time to do that. Sorry. Any other questions? I hope I've answered. If I didn't, ask again in a different way, maybe. Thank you, Hannah.
I wanted to ask a question. I don't know if it's relevant for anyone who's here now, but for the future, hopefully that we'll get to more rural areas. You were talking about children that don't have a toilet at home. I know from when I visited in Ethiopia, so really there are areas where the toilets or the bathroom is just a hole and it's not a toilet.
Yes.
So
Yes.
the question is, how would you train there? Like, would you train the child the way it is at home or the way it is in different places? Because maybe sometimes at school it's a toilet, as you mentioned, and at home it's not.
Yes. Believe it or not, even in South Africa, we have those. Where the parents live in rural areas and they have a toilet outside the house, which is a pit toilet. It's just a hole in the ground. They might have a cubicle built around it, but literally it is just a hole in the ground. Now, for them, we would take pictures of that. For some people, they cannot afford toilet paper and they use old, soft or softened cardboard or paper. They might use newspaper and then they would cut it and have a box or a packet or something next to the toilet or the hole, and they would be using that. So we would use literally what we get. So I'm not going to train someone who is living in a rural condition with a pit latrine to use a porcelain indoor toilet. I'm going to be using what I get there. A wooden plank in a hole. What we then use training them with, a piece. It would be cut in a strip like that, a piece of paper that they sit and they actually soften it up with their hands. They use that. We would then use this as an example. I would use what I get.
So part of the assessment when parents come is to understand how their toilet looks at home.
Yes.
If I understand correctly.
Yes. Okay. Yes.
So it's
now,
not
if they go to a school and there is a porcelain toilet at school, we would still have the photograph of my toilet at home and the photograph of the school's toilet so that the child can associate the two.
Okay. Thank you.
Okay. Any other questions?
What's the average age that you see children with autism that they're ready to train? Or is it not? When you were talking about the neurotypical, so you said that around 2.5. Is there any
Yeah.
average age around that they have
Average
been found?
age in a neurotypical child would be around 2.5. I see children as old as 7 and 8, not toilet trained. It is usual for children on the autism spectrum to train a lot later, 4, 5, even later than that.
Okay.
And then we get them from home, and the parents have no idea why they are late in toilet training. They just don't understand it. They come and they ask, please, can you fix the child? Because the child seems to them to be broken, but they're not broken. They're just late in their development. That's all it is.
Okay. Are there any other questions or any thoughts that someone wants to raise here before we say goodbye? Okay.
And again, the same as last week, if you have any questions that I did not answer or you didn't feel like asking tonight, please go via Renana and then I can answer questions.
Yes, that's of course always. You could also always, even if it's in the
Thanks,
future.
Leah. Thanks, Hannah.
Yes, also if it's in the future, you're always welcome to email me and I could pass it on to Antoinette, of course. I do have a few things I wanted to say. First of all, again, thank you so much. I feel that also last week and also this week, you're also giving us a lot of knowledge and also practical tools, which is something I think is very, very helpful. And part of what has to be done is the making it useful and relevant for Ethiopia and for the culture and for the language and all of those things, which is this is my opportunity to ask the people who are here that if throughout these webinars you come up, you create things of your own, if it's pictures and helpful instruments, I would love if you would be able to share it with me specifically, and then if you allow me to send it out to other people as well, because I know a lot of these things are time consuming. To make all of these pictures and to make these things, it takes time. And if you're doing it anyways, I think other people in our community would be very happy to do this. I know that I could say for Israel that I know a lot of things exist in our language that are based on our culture, but in Ethiopia, I don't know how much that exists at this point. So we're trying to build it together. So if any of you really do make and create any of your own things and you're willing to share it, I would be more than happy if you could send it to me. And hopefully one day we'll have also a website that people will be able, as you pointed out, you sent us to a few different websites. So one day that we'll be able to point out people a suitable website for people that read or speak Amharic. So that would be great. I'm posting the link here. I just posted it now for the follow-up questionnaire. So if you could please answer it, that would be very, very helpful. And I want to thank you again, Antoinette, for everything. And we'll see you next week, right? For our third and last. I can't believe it's already the last session.
Oh, no.
No, it's really, it's going by so quick. So next week, right, you're talking about parent-child
engagement.
Yes.
Yes.
So whoever is interested in that, you're welcome to join us, of course. And that's it. Hope you all have a good week. We'll see you next week, hopefully.
Thank you, everyone.
Good night. Good night. Benaderu.